Hey everyone, welcome back for another case. My name is Dr. Iyer. I'm with Residency Medical and I have another high-yield USMLE case for you. The case is about a 44-year-old male who comes in with a 6-month history of yellowish discoloration of his big toenail and also a thickening of it as well. He's an avid runner, he's been running for a long time, and he uses the same shoes while running. He has no other medical problems, no other medical history, and takes no medications. Based on this, and the image that you see below, what do you think the diagnosis is? And also, what's the treatment? Is there a combination treatment that may be necessary? Comment your diagnosis below and like and follow for more. Were you able to figure it out? Also, what was the treatment? So the answer to this case is called onychomycosis. I know it's a weird word, but onycho means nail and mycosis means fungi. So it's a fungal infection of the nail. And it's usually called by tinea species, which are superficial growing fungi. The way to treat these is to actually give a combination of systemic and topical therapy. Topical meaning you put it on the problem, and systemic meaning through the blood. The reason why you can't just use topical therapy in these patients is because it's a nail. The nail is really thick, right? It won't be able to penetrate all the way through to the site of the infection. And the way to diagnose this condition is to take a bit of the nail or take a bit of the infected area, mix it with KOH, and look under the microscope to look for hyphae. Hyphae are the extensions of the fungi, how they grow and reproduce. So let's talk about the treatments now. The first treatment is a topical agent, which is not the main one. The systemic is more important, but the two topical agents you can use include cyclopyrox and efinaconazole. All right, but they need to be used in combination with the systemic therapy. And your two options for systemic therapy, the best option being terbinafine. The second option is itraconazole. So combining these therapies will have a very high chance of eradicating this problem. One last thing to leave you with is that this patient probably got the condition because the moist environment inside the tennis shoes from the running and the sweat was a perfect environment for the fungi to grow and take over the patient's nail. So be careful with your tennis shoes. I hope you enjoyed this case and learned a lot. See you next week for another.